Rapid Rates, Teen Pregnancy, and Unwanted Births by TRogers. Following the rates around the country and Mississippi. As a parent, we want the best for our children and we want them to grow and be a productive citizen. While this is what we want, teen pregnancy is a growing problem. The rates have been down in recent years compared to those in the past. However, there is still an exponential growth in the southern states, and we as parents have to try to skew the numbers by educating the youth. Ways that we can educate them will be to explain that abstinence is the best policy, but if they want to continue to have the urge to have sex, we need to explain what contraceptives are and how to use them. In 2009, birth rates were lowest in Northeast and Upper Midwest and highest in the southern states. While the numbers are falling in some states, we have yet to get this number below detrimental. The teen birth rates in the U.S. have declined but remain high, especially among black and Hispanic teens in the South. Some of the things that we do are working, but others are not. This not only hurts the people who get pregnant, but it also hurts the families who are involved, including the society that they live in. Currently in the South, we have one of the highest rates among black and Hispanic teens. Mississippi was ranked number one out of 51 states and the District of Columbia on 2010 final teen birth rates among females aged 15 and 19 years of age. If we break them down by the numbers, this is how it will look. Mother's race, and we'll look at her age. Non Hispanic white, 2,427. Non Hispanic black, 3,537. Hispanic, 157. Females aged under 15, 111. 15 to 17, 1,959. 18 to 19, 4,118, for a total of 6,077 unwanted births. And this information is as recent as this year. Causes and responses. There are a lot of things that play in the role of teen pregnancy. If we can delete some of those factors from the teen's life, we might be able to get those numbers to drop even faster. Adolescent pregnancy and childbearing are national problems that affect the community and society at large. We're not only taking care of our children, but also their children. This was not the way our society was designed. Young women who have babies end up being single mothers who care for their children by themselves. Adolescent mothers become economically dependent due to their decreased educational attainment, their decision to keep and raise their children, subsequent high fertility rates, and greater occurrences of single parent families. Research shows that many young females become pregnant intentionally because they don't see any other life goals within their reach. Young girls who become pregnant at an early age are affected in more than one way. They have a hard time getting full time employment, they do not want to go back and finish school, and they find comfort in bad sexual habits, putting them in the position to have more children before getting married or finishing school. Contraceptives. We can't continue to be the parents who stand by and not discuss this issue with our teens. They are having sex, and we need to address it and help them along the way. There are a lot of contraceptives that can prevent the unwanted pregnancies. There are hundreds of adolescent pregnancy prevention programs available to teens today. Yet, it is difficult for educators and practitioners to know which of the programs serves as best practices. Some programs and help is not provided to the younger girls without a parent's knowledge. However, if this is going to prevent them from a big mistake, we need to take every action possible. Also, young fathers are just as responsible for the births as well as the mothers are. The Adolescent Family Life Program, administered by Health and the Human Services, affords educational information and social services to teen fathers to help them realize their roles and responsibility as a parent. Contraception, including emergency contraception, is indicated for teenagers. It should be provided. As other women, adolescents also have a right to abortion services, although the availability of such services is not uniform across the country, and teenage girls of low socioeconomic status or from visible minorities have limited access. The programs they offer are for educational purposes, and they also provide them with birth control. They are pills, condoms, shots, and minor surgical procedures that can be used to prevent unwanted births. Education is the key. Moving forward, we have to be the parents who want something different. We don't want our children to be just another number. A way to do that is to educate ourselves and our children about sex, about being protected and taking the proper precautions in order to maintain the living standards that they want to live by. We have to do more. The numbers are astonishing and hurtful to any parent. There are so many babies and children out here in our society living in poverty because of a mistake. We can learn, educate, and protect our children for brighter futures. My final thoughts, as I have stated in the slides before, we need to do better as parents to help with this epidemic. There are factors that play into why our young children are having unprotected sex, henceforth, having more babies. Babies having babies is an understatement. Demographic and socioeconomic factors are likely a major contributor to state level variation in unintended pregnancy rates, the researchers say. Less clear is the role of states' family planning services, the accessibility of abortions, sex education policies, and contraceptive coverage. One thing is for sure, if we continue to stand by and do nothing, our country will continue to decline. We need to make being a teen as fun as cigarette commercials make it for smokers. If we save one child from having an unwanted child, we can save that child from repeating the patterns set by their parents before them. This is not going to be an easy job, but if we want a better result, we have to put into action a plan that will work. Our roles need to change from being a friend to an educated adult armed with the knowledge to protect the youth. Our youth really are our future, and the future will be much brighter if we stand together to get the job done. Thank you for your time.